Well, the Workers' Party is starting a new initiative on the 16th of October called NHS on Call with Dr. Bob Gill, who's a prominent Workers' Party member. And we're going to be discussing the state of the National Health Service, the way in which it's being completely undermined by the present Labour government, and of course was done so by the previous Conservative government as well. And Bob is a campaigning GP who produced the film, made the film, The Great NHS Heist. So he's probably the country's premier expert on the National Health Service and what is actually being done to it, and how we might be able to build a campaign to save our National Health Service, or maybe to, more accurately, to restore our National Health Service. So we're starting this on the 16th of October. It'll be a 45-minute X space where Bob and I will be in conversation, but we're also hoping that we will get contributions from listeners as well, because I know that people up and down the country are very concerned about the state of the National Health Service. So, Bob, just say a few words really about the sort of topics that we're going to be covering when we start this new initiative in a couple of weeks' time.
Yeah, I think a good starting point would be to give people a brief overview of what's happened to the NHS. You mentioned two governments. I would go back as far as Margaret Thatcher. We've had 4 decades of stealth privatisation. It's never been called as such. It's been happening covertly. The NHS maintains its logo, but more and more of the services are outsourced. The ownership of the buildings is being privatized. So there's a lot of ground to cover. But I think, as you know more than most, is our media have very deliberately kept the public in the dark. And I think what our discussions will help to do is to lift the lid of this gross betrayal, because the politicians and the corporate interests that they are serving could never get away with this if there was public awareness. And they've been extremely effective in keeping this hidden from public perception.
Yeah, I mean, and the NHS is considered to be like a jewel in the crown of the country, isn't it? And it's really respected and loved by the general public. But lots of people have had a lot of complaints about the NHS, but people still speak very warmly about the NHS, the treatment that they've received, for example, in hospitals and so on. But also there are a lot of people are unhappy about the length of time they have to wait for an appointment. To get a GP appointment is very, I know obviously not so much in your case, Bob, the way in which you run your GP practice, but I don't know, from my own personal experience, trying to get a GP appointment is very, very difficult indeed. You've got to ring at 8 o'clock in the morning, and when you ring dead on when the pips go on the radio, you ring and you might be number 10 in the queue. God knows how people get it before, and then you're lucky if you can actually see a doctor, and you might then have to ring the next day and so on. And I remember. Back in the day, Bob, when I was a youngster, you never had appointments at all. And then they brought an appointment system in where you can make an appointment. That was quite convenient. But my GP practice at that point in time had the appointments, but if you weren't able to make an appointment, you could still turn up at the end of the appointment period and just wait in turn to see the GP. And you'd also see your GP if there was an emergency and a call out. The GPs were on call, and so you had that kind of connection with the GP in a way that it doesn't really exist in my experience, and indeed with the people I speak to either. I mean, there's been massive changes, hasn't there, over the last 40 years, just in terms of the way people consume the National Health Service.
Absolutely. It's a standard mechanism for privatization. You wreck it first, you get people angry, so they're ready to abandon it. And the NHS, as it is at the moment, I would not defend, because so much has happened to it. It's been utterly repurposed. There's been so much what people call friction introduced within the NHS, the basic administration, the decision making has been taken away from the doctors and nurses. So now we have a system which has been made deliberately dysfunctional to raise dissatisfaction, to make the workers within the NHS fed up You're driving people to early retirement, or they're just leaving the NHS and going into the private sector or leaving the country. There's a lot of dissatisfaction amongst patients and professionals for exactly the reason that they want to destroy the faith in the NHS. And, we saw that with British Rail. You underinvest for years, you make it a laughing stock, you joke about the curly sandwiches available in the restaurant car. And then once it becomes a laughing stock, it's easier to press the privatisation button. It's been harder in the NHS because it's such a big enterprise. So they've had to proceed by stealth. The propaganda is constant. They only report the NHS when it's failing, but they don't explain that actually it's an outsourced private service that is failing, or how successive government policy has caused it to fail. And you bring up the difficulty getting GP appointments. There are so many factors that have driven us to this current point. The changes in the contract, the biggest change in the contract occurred in 2006 under the Labour government. Patricia Hewitt drove through a reform within general practice, which essentially removed the advantage of continuity of care. It no longer incentivized continuity of care. And it created a system whereby you could have a two-tier GP workforce. You could have partners and you could have salaried doctors. And then they opened the floodgates for the entrepreneurial types to start to exploit other doctors. And then you had people like Virgin moving into primary care. So there is so much to understand what went on to understand the current predicament. And hopefully our discussions will remove the simplistic headlines that are out there to demonize the NHS, to give people an understanding, so they do register that this is very deliberate, very conscious, very well thought out sabotage.
No, absolutely, absolutely. And I think it'll be really interesting, won't it, Bob, to hear people's experiences from up and down the country. And I think there's a potential here to sort of build a campaigning a national movement to restore our National Health Service. I want to say save our National Health Service, but it's essentially we haven't really got a National Health Service anymore, have we? I mean, the way in which they've sort of fragmented it so much now. I mean, it's not really the National Health Service that people know and love, is it?
Yeah, we've had successive legislation. If the government was genuinely interested in reform to improve the service, you would not need primary legislation. They've had to introduce primary legislation to replace the Bevan model. So back in 2014, it was enshrined in law that it was the duty of the government to provide universal healthcare. That duty to provide in law was removed. So now there is no longer a statutory duty to provide health services.
No,
now, most people are completely unaware of that. And once you've taken away that founding principle of the NHS, then you can start salami slicing away and cutting away services and introduce barriers to access. So, it has been a very well thought out betrayal, unfortunately, for us.
And I think perhaps just in conclusion for this preliminary conversation, Bob, I mean, I would say that, knowledge is power, isn't it? And, hopefully this X space, Twitter space will grow and give people the information, give them the tools to be able to hold policymakers to account and to give people the confidence, maybe to hopefully, organize local campaign groups, to contribute to existing campaign groups, to, push this agenda. When people in this country are motivated, as we saw, for example, when on an unrelated issue, when they wanted to hive off the top Premier League football teams and create a super league, there was a massive outpouring of opposition from the supporters, and that kind of people power was able to overturn what seemed to be a fait accompli. And this is a much more important issue, although I know Bill Shankly said that football is not a matter of life and death, it's more important than that. But I do think the National Health Service is pretty important, probably more important than sport in that sense. So I think this has a potential, doesn't it, Bob, to to give people the tools to be powerful and penetrative campaigners up and down the country.
Absolutely. We have to give them the detail, but also distill it down to the key facts. The key facts are the NHS has been repurposed. It's following the American model, and a health service which is turned into a cash cow for corporations. Well, they're going to make money through the denial of care or giving you unnecessary but expensive treatments. That is not good for the patient. That is not either very good for the professional. And if you want a dystopian, very expensive system, which abandons you when you're extremely sick because now you've become very expensive, you have to look no further than the American system, which by the vast majority of the public in America are pulling their hair out in terms of how they're being fleeced and damaged as a result of their grossly expensive, profit-driven, inhumane system. And that's the system our politicians and political class have copied on behalf of private corporations.
Yeah. And of course, it's an absolute scandal that it's a notional Labour government that is actually bringing about the full demise of our national health service. And as I say, we need to give people the tools to fight back. But I think we'll leave it at that, Bob, for now. As I say, this is just very much a preliminary conversation, just to sort of test the system and make sure that we can work the X space properly. But I shall look forward to our conversation starting on the 16th of October. I know we've got a few people who've joined us already, even though we didn't announce that we were going to have this preliminary conversation now. So I think with a bit of pre-publicity, hopefully we will get a good conversation going, and it will be very much about giving people the opportunity to, particularly, speak to you about the issues, and we could talk about how we can afford these things, and some of the economic questions and so on, which of course, in a country the size of Britain's economy, money's no object for the government, and we can have the very best, or could have the very best, health service in the world. And there are other issues, of course, swirling around. I mean, for example, Wes Streeting, not to get into a conversation about it now, it's a petition I seen circulating today, calling for him to be removed because he's using his position, abusing his position, to discriminate against NHS doctors who speak out in support of the Palestinian people and against the Holocaust that's taking place in Gaza right now. This is an absolute, in my opinion, abuse of his position, and something which does need to be called out. And again, these are other areas that we can talk upon. But the agenda, to a large extent, Bob, is going to be driven by the listeners and the questions that they come forward with. But we'll, as I say, leave it for now, and we'll see you on the 16th of October, mate.
Thank you very much, Chris. I look forward to it.
Great stuff. All the best. Cheers, mate. See you.